Pediatric epilepsy is very much a clinical diagnosis, and what that means is we really base the diagnosis on the information about the spells or spell type that the child or teenager has suffered, and that is means that we need to carefully get a history from the person who actually saw the event happen, whether that be the parent, which is the most common. Sometimes it's the teacher, it's a friend. It's really important to try and get the information from the person who saw the event happen, because they can give you the best description. And then in addition, we will get information from the child or teenager themselves, and that's important because oftentimes they'll have information that they haven't shared with anybody, but it's really important information that can help tell us what kind of seizure it was and where that seizure may be coming from in the brain. So then the other part of the diagnosis is doing some further testing, and almost all the time we will obtain an EEG test or an electroencephalogram, and what that is a test where they attach a number of wires to the child or the teen's head, and oftentimes we will try and have the child or teen fall asleep as well, because we will get better information from the EEG when the person falls asleep. And that test usually takes about an hour. Even if the person doesn't suffer one of their seizures during that hour, and most of the people will not, we can still get very useful information. In most cases, if somebody has a predisposition towards seizures, or somebody who has epilepsy, the EEG is most often abnormal, showing a signature that they are prone to have seizures. So the EEG can give us very good information as to the type of seizures, where specifically the seizure may be coming from, and help us choose appropriate treatments and other investigations. And then the other test that we often will do is an imaging study. Usually we do an MRI test, and that's just a picture of the brain, and that is looking for any changes in structure in the brain that may tell us why the patient is having a seizure. But again, there are some cases where we don't need to do the MRI test. We have an inpatient monitoring unit that's over at St. Mary's Hospital, and that is used for a number of cases. So the most common time that we would use that is if we have a child who clearly has epilepsy, and his or her epilepsy cannot be controlled well with medication, and we think that child or teenager may be a candidate for surgical treatment of their epilepsy. And what that means is that we really do need to capture a number of their seizures, and so we can figure out exactly where in the brain those seizures come from. And in that situation, we will bring them into the Epilepsy Monitoring Unit. We have one of their parent or their caregivers stay with them. They have an EEG placed, and that EEG monitoring is then continued for several days, and we record several seizures. So that's one of the reasons we would use that epilepsy monitoring unit. A second reason to bring the child into the epilepsy monitoring unit is if we have a child who is having spells, but it's unclear whether those spells are seizures or something else. And in that situation, before we embark on a lot of different trials of medication, or in some cases, patients have already been on a number of anti-seizure medications and we're not sure that the events that they have are truly seizures, then we'll actually bring the child into the monitoring unit to try and capture one of those spells, again with EEG monitoring. And so we can tell if during the spell there is abnormal electrical activity coming from the brain. That tells us, yes, it's a seizure. If there isn't abnormal electrical activity coming from the brain, then it's not a seizure, and we really need to then look for another cause. So when children have epilepsy, it's not just the seizures that are the problem for those children. Many children with epilepsy will have what we call comorbidities or other medical and learning issues that relate to the epilepsy. So for example, we know that children who have epilepsy do have higher chances of having behavior issues, higher chances of having learning issues, attention issues, and so it's really important when you're treating a child with epilepsy to not just treat the seizures, but you really need to treat the child, and you need to look at those other aspects as well. And we are very fortunate to have very good neuropsychologists and other psychologists, behavioral psychologists who work with us and will help families and children deal with that side of the epilepsy as well. Knowing that is also important when we choose certain medications for seizures, because we know that there are certain seizure medicines that, although they're very good seizure medicines, one of their side effects is to make it, or to give problems with learning, to give problems with behavior. And so it's certainly in children who have that tendency, who have epilepsy, we would try and steer away from those types of medications.